anatomy of human reproductive system. The human reproductive system consists of a network of organs and signaling molecules that interact and communicate to give rise to the human ability to produce and bear live offsprings. The human reproductive system has two main systems, which are male reproductive system and female reproductive system. So you can look at the diagram of male reproductive system. So the male reproductive system includes a group of organs that make up a man's reproductive and urinary system. These organs produce, maintain, and transport the sperm and semen. The male organ discharges sperms into the female reproductive tract and they produce and secrete male sex hormones. The male reproductive system is made up of the internal and external parts. Together, these organs help you urinate, have sexual intercourse, and make children. The entire male reproductive system is dependent on hormones. These are the chemicals that stimulate or regulate the activity of the cells or organs. The primary hormones in the functioning of male reproductive systems are follicle stimulating hormones, which is FSH, and then the second one will be a luteinizing hormones, which is LH, and then testosterone. The FSH and LH are produced by the pituitary gland and it is located at the base of the brain. The follicle stimulating hormone is necessary for sperm production, which is spermatogenesis. The LH stimulates the production of testosterone, which is necessary to continue the process of spermatogenesis. The testosterone is also important in the development of male characteristics, including muscle mass and strength, fat distribution, bone mass, and sex drives. So now we'll look at the female reproductive system. This is the diagram of female reproductive system. So how female reproductive system works? The female reproductive system is made up of internal and external structures. Its function is to enable reproduction of the species. Sexual maturation is the process that this system undergoes in order to carry out its role in the process of pregnancy and birth. The organs, structures, and functions of the female reproductive system gives women the ability to produce a baby. They do this by producing eggs in monthly cycle known as menstruation cycle to be fertilized by sperm from a man. Other structures such as breast give the mother the ability to feed and nourish a baby after a birth. The organs of the female reproductive system are found both inside and outside of the female body. The organ inside the body are in the pelvis, which is the lower part of the body cavity above the legs.
Psychological factors and aspects of human reproductive system. As Van Dan Acker points out, focus on sexual and reproductive health is not a privilege but it is necessity. Reproductive psychology deals with the different processes involved in childbearing, adjustment to pregnancy, or attitudes to motherhood and fatherhood. It also addresses psychological aspects of reproductive problems such as premature birth, prenatal loss, congenital abnormalities, and postnatal psychological complications, including postnatal depression and stress disorder, and of course, the psychological and social aspects of infertility diagnosis in males and females. As with reproductive medicine, in having children, involuntary childness, and the overall care received in assisted human reproduction are central to reproductive psychology. Goal of reproductive psychology. So main goal of the psychologist in this context is to promote informed productive decision making and psychological health and well-being throughout all stages and aspects of the reproductive process. And reproductive health or sexual health denotes the health of an individual reproductive system during all life stages. WHO define health as a state of complete physical, mental, and social well-being, not merely the absence of disease and infirmity. Reproductive health is a part of sexual and reproductive health and rights.
Specific illness in human reproductive system. A reproductive system disease is any disease of the reproductive system. There are types of infections and diseases that occur in reproductive system or common in the reproductive system. RTI, congenital abnormalities, functional problems, common reproductive health concerns for women and men, functional problems, cancers, sexually transmitted diseases, and so on. In this video, I'm going to talk about the reproductive tract infection, congenital abnormalities, sexually transmitted diseases, erectile dysfunction, polycystic ovary syndrome, cancers, endometriosis, uterine fibroids, testicular torsion, varicocele, Peyronie disease, priapism, cryptic pregnancy. Reproductive tract infections are infections that affect the reproductive tract, which is the part of the reproductive system. For females, it affects the upper tract and the lower tract. For males, it affects the penis, testicles, urethra, or vas deferens. Congenital abnormalities are any abnormality present at birth, regardless of the cause. Examples can be Kallmann syndrome, androgen insensitivity syndrome, intersexuality. Sexually transmitted diseases are also referred as sexually transmitted diseases and venereal diseases, or illnesses that have a significant probability of transmission between humans by means of human sexual behavior, including vaginal intercourse, oral sex, and anal sex. Common sexually transmitted infections include gonorrhea, syphilis, chlamydia, genital warts, genital herpes, HPV virus, and HIV. Cancer. Cancer is a group of disease involving abnormal cell growth with a potential to invade or to spread to the other parts of the body. Worldwide estimation is currently at 19.3 million new cancer cases are being found, and 18.1 million excludes the skin cancer, and heartbreakingly 10.0.1 million people die because of the breast cancer, surpassing the lung cancer. There are lots of types in cancer in reproductive system. So there are prostate cancer, breast cancer, penile cancer, testicular cancer, cervical cancer, benign prostatic atrophy, gynecologic cancer, cervical cancer, uterine cancer, vaginal cancer, vulvar cancer, and ovarian cancer. Uterine fibroids are the most common non-cancerous tumors in the women who are in childbearing age. The symptoms of the uterine fibroids include heavy or painful periods or bleeding between periods, feeling full in the lower abdomen, urinating often, pain during sex, low back pain, reproductive problems such as infertility, multiple miscarriages, or early labor. Cryptic pregnancy is when a woman is unaware that she is pregnant. Sometimes the woman will realize when she is pregnant while she is in the third trimester or goes into the labor. Recent studies on cryptic pregnancy are hard to come by. A 2011 review is available. Research finds that 1 in 475 women deny the pregnancy at 20 weeks or more. More often, women with cryptic pregnancy, they do not experience the typical symptoms of nausea and the others like normal pregnancy. Even the doctors and relatives may not be aware that she is pregnant. Doctors classify most of the cryptic pregnancy as a psychotic or non-psychotic episode. In 2011, women with psychotic denial of pregnancy may have mental illnesses. It was considered as mental illnesses. A sad reality truth is even the normal pregnancy test may come back as negative even though you have missed your periods. The HCG hormone will not be appeared in this type of pregnancy results or test, which is will normally taken by the people who are getting the test for their positive or not. Testicular torsion occurs due to the rotation and twisting of the testicle. This causes swelling and eventually cuts off the blood supply of the testicle. The annual incidence of the testicular torsion is approximately 1 of 4,000 people who are under the age of 25 and the highest prevalence between 12 and 18 years old. It occurs without an apparent cause, but it has been associated with anatomical, traumatic, and environmental, and among others. Varicoses is a vein above the testicles. All the veins have walls inside them that keep moving in one direction. With varicose veins, these walls have failed and blood can pool, eventually making the veins bulge. Peyronie's disease is caused a scar tissue or a hard lump formed inside the penis. The cause is not clearly known through the trauma, such as hitting hard or bending of the penis may be involved. Priapism is the medical term for a persistent erection that lasts at least 4 hours. It is very painful and may not be related to sexual stimulation or activity. If being untreated, it can cause the damage to the penis, says the experts. Erectile dysfunction is a sexual dysfunction characterized by the inability to develop or maintain an erection of the penis during sexual performance. Psychogenic erection is achieved by erotic or emotional stimuli. Chronic periodontitis is a common disease of the oral cavity consisting of the chronic inflammation of the periodontal tissue, often caused by accumulation of profuse dental plaque. Polycystic ovary syndrome (PCOS) happens when a woman's adrenal glands produce male hormones than normal. Once results in cyst or the fluid develop on the ovaries. Women who are obese are more likely to have PCOS. Women with PCOS are increased risk of developing diabetes and heart disease. Endometriosis is a problem affecting women's uterus where the baby grows when she is pregnant. The tissue which grows normally lines in the uterus grows somewhere else in the other body parts like ovaries, behind the uterus, or in the bowels or on bladder. Rarely it grows in the other parts of the body. The misplaced tissue can cause pain, infertility, and heavy periods issue. This pain will be usually in the abdomen, lower back, or pelvic areas. And up next, we are going to look at the ways to keep our systems in good health.
Bill Gates once said, "The human body is the most complex system ever created. The more we learn about it, the more appreciation we have about what a rich system it is." And Eckhart Tolle says, body awareness is not only the anchors for you in the present moment, but also a doorway out of the prison, that is the ego. It also strengthens the immune system and the body ability to heal itself. And eat the right kind of food and maintain a balanced diet. And second, avoid junk foods and drinks. Visit doctor regularly so that you can detect any irregularity of disease involved in reproduction system, and so that it will be cured. And third one, changing your pads every 3 to 4 hours during menstruation. Never wear trousers or tight jeans that may affect or irritate your genitals. Exercise regularly, run a mile, lift weights, take a stroll, and play outside. Sixth one, keep a track on your menstruation. 7. Don't engage into vices. And last but not least, don't stress yourself too much. And finally, make your body smile swab. Keep your body system clean and healthy. Why don't we combine for the care of the system that expands human hygiene? Take a bath, a change of clothes every day is all we need to make a change. Let us all start within ourselves.